This is Shelley Craft coming to you live on SNNLive. We're at the second annual Growth Capital Expo, Las Vegas 2015. I have with me Mr. Michael Oliver, SpectraScience. It's a publicly traded company and the symbol is SCIE. Mike, welcome back to SNNLive.
Thank you for having me, Shelley. It's always a pleasure.
And thanks for coming to the Growth Capital Expo.
It's a great show. You do a great job.
Thank you, man. So let's get right into it. Give us an overview on the company.
Sure. As you remember, SpectraScience is a medical device company. We use light-based technologies and the interaction of that light with human tissue in order to diagnose cancer. We do it without removing the tissue from the human body, and we do it in about 1 second.
Let's get an update since the last time you've been on SNNLive. Anything happened recently?
Well, we've always got a lot happening, but we were really pleased to see in the UK that the National Institute of Health Research, where we're doing a very important clinical evaluation of our product, recently wrote and published to the entire National Health Service. So that's every hospital in the UK, the advance notice that our product was going to be available for them later this year. Probably be in the third or fourth quarter, but we're really excited about the pending approval, because what that does, it allows us to sell our product in every hospital in the National Health Service, and they know it's been accepted by the government as a standard of care.
That's big news.
That's great news for us, and so we're actively looking for opportunities to grow a sales organization and begin our active sales and marketing efforts in the UK. We hope to follow that soon in Germany and France as well.
And then, you know, I could see it going directly into India and China. I just feel it.
There are a lot of other markets that we can certainly investigate, but you know, we're a relatively small company with limited resources, so we're going to keep our eye on the ball and make sure that we really drive those 3 particular countries. Now, we do have, in all the peripheral countries in Europe, Denmark and Norway and Sweden and Italy and Spain and the like, distributors. And so they'll be able to use the same kind of information to sell in their particular markets.
Once you're approved in the UK, do you get any other countries to adopt it?
Well, it's interesting. The UK is actually followed by a lot of the Scandinavian countries. So we think there'll be a lot of carryover. And again, we've got sales organizations through distributors that'll be talking directly to the customers in those countries.
How does this affect what you're doing in the US?
Well, it gives us the legitimization that we so badly need for both a market perspective and for investors. Of course, we still have to do an update with the FDA as we go from generation 3 to generation 4 in the US. This is the 4th generation product that we're selling in Europe right now.
So if I asked you to give me your insight as to the outlook of 2015, the balance of, and 2016, how would you couch that?
Well, given everything we know today, we expect in 2015 that we'll get our Mortis evaluation complete. That's the clinical data that really proves both economically and clinically how good our product is. And then that's really our leverage for getting additional financing, that we can finish our commercialization efforts in Europe, which should really bear fruit beginning the end of 2015, but really moving into 2016. And we should begin to see really critical sales into the average account, not just the academic medical centers who will buy one of everything.
Ladies and gentlemen, let's get a website for more information.
www.spectrascience.com, SPECTRASCIENCE.com.
Ladies and gentlemen, Mike Oliver, SpectraScience, a publicly traded company. The symbol is SCIE. I'm Shelley Craft. This is SNNLive, and we're coming to you from the second annual Growth Capital Expo in Las Vegas 2015. Mike, thanks for coming on to SNNLive.
Thank you for having us, Shelley. It's always a pleasure.
You got it.